I know what grief is, and I wanted to be able, with Jaja, to be able to be there to help in any way I could with their journey. Hi, my name is Terry McCoo. I have been with Pikes Peak Hospice and Palliative Care Pet Therapy Program for 5 years, and this is the star. Her name is Jaja. We have two things that we do. First of all, we go to the IPU at Penrose, which is on the 6th floor, and if there's any patients there that are able to be with her, we do that. Or if a patient has passed away and the family is in there, she will be invited in and she'll be with the family. It's amazing what she does for them. During such a difficult time, she can lift their spirits. It brings them a smile and kind of gets them away from what has just happened. The other thing we do is we do pet therapy for different patients at different facilities that want pet therapy. And she will go in, and we go to the patients that we are assigned to and just go in and visit. A lot of times I'll just hold her like I am now, and they'll pet her and everything. But most of the time they want her in their chair or in the bed. It's rewarding knowing that you might have been able to help a bit. And with her, what she does for them, she takes it on. She can feel them. She knows that something's not quite right, and so it's almost like she gives more of herself, because when she gets home, she's exhausted. And so seeing that is what helps with the volunteering with hospice as well. I always wanted to volunteer anyway. After I was a business owner, I always said that when I retired, I wanted to give back. When I heard about them, I said I wanted to try to get on board, and I did. And then I found out it's, I believe, the only nonprofit. I won't work for anybody else that's for profit. You're here to help. And that's what Jaja wants to do, and I want to do is work for somebody that actually wants to give of themselves with nothing in return, really, other than what you get from the patients. To become a volunteer, I had to go through orientation. Jaja also had to be interviewed, and we had to pass all the tests to make sure she was certified. Before they can even be therapy dogs, they have to go through training, and she was not quite 2 when we started her obedience training. And it took a little bit of time because she's a princess. However, she passed that, and then you have to be certified through the Alliance of Therapy Dogs. And she's just perfect for the program. She just has a mellow attitude, loving attitude, and she just brings so many smiles to so many people's faces, especially during difficult times of grief and the patient who may be dying. She's been doing this since she was 8 weeks old. She loves the clothes, and the people just get the biggest kick out of it because she looks adorable, like a diva, which she is, although she doesn't act like it right now. Very mellow. But yes, she always has something. And last week we celebrated Nurses Week at Penrose. Her and her boyfriend, who's a Shih Tzu, was dressed as a doctor, and of course she was dressed as a nurse. So there are special events that her and Roscoe do. Roscoe is also another hospice therapy dog. It is the most rewarding thing anybody could do, as far as I'm concerned. I highly recommend it. It's amazing, giving your heart and receiving heart from the patients. And yes, I totally recommend it. And I hope we get more volunteers. We need them. We just want to be there for them and help them get through as best that they can.